In a health alert, the FDA recently approved the world's only twice-a-year shot to prevent HIV, the virus that causes AIDS. The vaccine is marketed under the name Yeztugo and can be used by both men and women. With more than 30,000 new infections of HIV in the U.S. each year, Dr. Shirin Mazumdar of Methodist Le Bonheur Healthcare joins us now to talk more about the life-changing drug. Doctor, glad to have you here in person.
Thank you,
Good to see you on the news at 3.
Thank you so much for having me.
My pleasure. Let's talk about this drug. It's been called a breakthrough, hailed as a game changer. How do you see it?
So we have been anticipating the release of this medication in the HIV prevention world. This medication is unique because it is given twice a year, and it is incredibly convenient because it is dosed so infrequently. And in addition to being dosed so infrequently, it is very, very effective, over 99% effective.
Over 99%?
Over 99% effective in preventing HIV. And we know that the medication works well in a lot of different populations. We know that it works well in women, men, young people, older people, and pregnant women. So it's a medication that we've really been anticipating, and I think it's a great new option to have in our HIV prevention toolbox.
Could this potentially also lead to maybe ending the HIV epidemic? I mean, what are your hopes there?
Yeah, you know, short of a vaccine, I think given the effectiveness of this medication, I am very hopeful that this will play a role in ending the HIV epidemic for everyone.
That is major there, to say the least. Again, we're talking about the drug is for high-risk patients right now. Do we see that changing?
So right now, this medication is indicated for people at high risk of contracting HIV. And so there are a lot of different categories of people that fall into that category, but it is primarily used to prevent HIV in high-risk individuals.
I know I was reading in clinical trials, it was proven to be extremely effective there. Where do we go from here with this, though, when it comes to maybe, do we know yet about a cost for the drug?
Yeah, I think the major issue with this medication is going to be access. What we've heard from the drug manufacturer is that it will be about $29,000 a year for this medication. And there are some unknowns right now, including how well insurance is going to cover this medication, what kinds of programs or services we will have for people that are uninsured or underinsured in terms of accessing this new medication.
Because the last thing you want here is for people to be priced out of actually being able to get this medication.
Exactly, right. I think access is such a big deal because if we can't get it to people, then it really doesn't help us.
So how soon will all this really, it seems like it's moving pretty quickly right through here and now. When it comes to availability, how soon do you think it'll actually be out there?
So this medication was just approved for HIV PrEP, which is pre-exposure prophylaxis, on June 18th. And so this was a very recent approval. It just came on. So I'm hoping that in the next few weeks to few months, we can figure out the logistics to get it to people.
When it comes to HIV as a whole, though, have we made a lot of strides in recent years? Because we don't hear as much talk about it, but we still know it's out there. Yeah,
we've made strides in terms of what types of treatment options we have available and what types of preventative medications that we have available. But HIV is still having a significant impact on our community, especially. Here in Memphis, we rank #2 for new HIV infections in the entire country.
In the entire country?
In the entire country. So Memphis makes up about 40% of HIV infections in the state, and our existing cases of HIV infection are 3 times higher than the rest of the state and twice as high as the rest of the nation.
So how important, very quickly here, awareness and of course testing?
Of course, yeah. Increasing awareness, increasing education for people is critical, and testing is so important. It is so important for people to know their status, and we want to increase preventative services like PrEP, like Yeztugo, and other HIV preventative medications. And then lastly, we want to promote treatment. So people that do test positive for HIV, we want to ensure that they are linked into medical care. We have excellent medications to treat HIV now, very different than what it was 20 or 30 years ago. These medications are well tolerated, very easy to take, and so we want to make sure that people that are positive are on medication so that they can live a long and healthy life.
Doctor, you've shared some incredible news with us. Come on back anytime. Would love to have you here.
Thank you.
Always good to see you.
Thank you.
All right.